So epilepsy is a chronic neurological disease that affects about 1 in 100 people in this country, which is probably more than people expect. They tend to be younger and they need regular specialist follow-up. It's become a very complex disease in the last 30 or 40 years. Many of these patients don't need to be seen face-to-face on the hospital side at any one time.
For a couple of decades now, we've seen that our hospitals are in crisis due to overcrowding and prolonged waiting times. With trolleys in the emergency department, standing room only in the outpatients, and a record-breaking over 22,000 people on the outpatient waiting list waiting just to see neurologists, this is the state of hospital medicine in Ireland today. Now with the outbreak of Covid-19, healthcare teams in Ireland and around the world have had to change the way they work, with many of them making the move to telehealth. In St James's Hospital, where the ICUs are full and the waiting rooms have been emptied out, the epilepsy specialist team have been providing remote care to patients for years.
We've been ahead of the curve really in delivering what we call telehealth, or the ability to give remote care to patients.
Telehealth has been a quiet passion project for many doctors and scientists, especially epilepsy specialists in Ireland, for the past decade. Led by clinicians and researchers in our leading hospitals and third-level institutes, the eHealth research group in FutureNeuro, the SFI Research Centre for Chronic and Rare Neurological Diseases, hosted at RCSI, have been successfully embedding telehealth into our hospitals such as St James's and Beaumont. This investment is now paying off as FutureNeuro demonstrates the power of technology to aid in chronic disease management. Using video call services to contact their doctors from their home, the need for epilepsy patients to be constantly moving in and out of the hospital has been drastically reduced.
One of the key things we developed in relation to the interaction with patients remotely is what we call an e-portal. The patient can access their own record, give updates, keep a diary of events, and then when we have our virtual interaction, we both can look at the same record. I'm hugely hopeful that we don't go back to the usual packed waiting rooms scenario that we had before the pandemic. I think it will require investment, but there's no question that if anyone's ready for that move, we are.